Surface disinfection. Why? Over the last 24 hours, this handrail has been touched 327 times. Let's take a closer look. A contemporary of ours called Staphylococcus aureus can survive a full 7 months on the handrail, and from there reach patients through skin and hand contact. The transmission can lead to a nosocomial infection, so an infection you acquire during a hospital stay. To prevent such infections from occurring, surfaces disinfection is essential in medical areas. Disinfection kills microorganisms or inactivates them by using proven products that have been tested and listed. But just when is this disinfection performed? There are two types of surface disinfection: routine disinfection and targeted disinfection. Routine disinfection prevents the spread of pathogens in everyday work. It's performed on all surfaces with frequent skin and hand contact, for example, bed frames, as well as surfaces used for aseptic work like the preparation of medications. This process uses a disinfectant that, at the very least, has a bactericidal and yeasticidal effect. Once the disinfectant has visibly dried, the surface can be used again. By contrast, targeted disinfection must be performed when visible contamination or an outbreak has occurred. It is also done when special pathogens appear and a final disinfection is required as a result. For example, when a room is being prepared for a new patient. The application time recommended by the manufacturer must be absolutely observed. The spectrum of antimicrobial activity must at least be bactericidal and yeasticidal, and in case of a special pathogen, be adapted to it. And how do you properly disinfect something? Usually with the help of a wipe disinfection. Use a tissue saturated with disinfectant and wipe the surface with light pressure. Please keep one thing in mind. The surface being disinfected must be completely covered with the disinfectant. Damp wiping is not sufficient. For places that you cannot reach with wipe disinfection, use the spray disinfection. So they won't have a chance here.